I'm Susan Cox. I am a faculty member with the Center for Applied Ethics and the School of Population and Public Health, and I'm an associate professor. This is a new core course that it's really designed to give students in the program a good sense of a full range of research methods and paradigms, from qualitative methods right through to quantitative and more traditionally accepted methods in biostatistics and epidemiology. Through a series of activities that we've created that engage students in thinking quite deeply about their own orientation to research and thinking about their own life experience and the questions that they're passionate about, we get them to identify with particular kind of research paradigm and to think about the kinds of questions that some methods will allow them to ask. One of the activities we've done in the past that's worked very nicely is to have a focus group on a topic usually selected by the students, and we'll record that and transcribe that and use that as a small data set to try out some of the qualitative analysis techniques that we're looking at. We also use a lot of peer feedback and peer discussion in small groups so that students are actively learning from each other and their research questions as well as from posing their own. Because of the hands-on activities we do in the small group work, I think if it were to get much bigger than about 20, it would be hard to have the same distribution of activities, and that's something that the students have commented on very positively. The thing I think is probably most important in terms of my teaching philosophy is creating a vibrant and safe learning environment where every student is respected and valued. Along with that, I think goes acknowledging and incorporating each student's prior learning and knowledge and skills, so that I actively try and elicit from students contributions to a class that affirms who they are already and what they know and bring to the class. As a colleague and fellow teacher, because both my parents met in medical school here, the first graduating class at UBC. And my dad stayed on here in cardiology for a number of years, and he knew Cortlandt Mackenzie. I didn't get the chance to meet him. I'm deeply honored to get it. When I received a notice that I was a recipient this year, one of 2 recipients this year, I was just blown away. I mean, that makes me emotional just to have the question, because teaching is a privilege. I'm really honored by it. It's probably the best feedback I could get.